Hi, I'm Jenny Dozier, and today I'll be sharing with you my executive summary for our course. I look forward to your comments and feedback on my ideas. I'll be sharing today the role of Virginia's community college system in revitalizing our regional healthcare workforces. First, a little bit on the current state of our healthcare shortage in Virginia. We have nearly 20% of hospitals this year that classified as being critically understaffed. And earlier this year, a survey by the Virginia Hospital and Healthcare Association found that this shortage is a top concern for Virginians. By the year 2028, our Employment Commission here in Virginia is expecting that we'll need, for instance, an increase in 10,000 new nurses between registered and licensed practical nurses. And that's just one of many examples. We know that a growing workforce will be critical. We know that research shows that entry and mid-level healthcare workers do have a significant impact on our patients' outcomes. And this is right on trend when we look at national data as well. By 2025, as you can see here, we are expected to see a shortage in everything from home health aides to nurse practitioners. How did we get here today? What are some of the origins of this issue? And how does it help inform our decisions moving forward? Well, we do know that part of this issue comes down to an increase in demand in health services. And a lot of this comes down to the fact that we do have an aging population in this country. And this aging population results in a higher demand and utilization of health services. Our population and workforce is also aging, which means that we have more in our workforce who are headed for retirement. A number of healthcare workers that we have today has simply not kept up with our aging U.S. population. We're also seeing educational supply issues. We have only 3% of our high school programs which are focused on career and technical education and health sciences. There also could be some explanation in what we're seeing with our high school students who may not necessarily be as prepared in STEM disciplines as they could be. Couple all of these issues with the rising cost of education that our country has been facing for many decades now. Those who are in healthcare also face a higher than average student debt compared to other professions and professionals in other fields. This is an impact that is impacted more so for minority students as well. So it's disproportionately affecting those who are marginalized and at a disadvantage. When we take a look at our workforce growth and where we are now and where openings tend to be, we can see that our workforce here in Virginia in healthcare is growing at 4 times faster than it is for other occupations. And many of the occupations that you can see here in this data chart are entry level. They're also essential positions to help maintain system capacities. And most of them require an associate's degree or a technical certification training, which can be earned at a 2-year degree granting institution. That's where Virginia's community college systems can help. In fact, our mission statement states that we give everyone the opportunity to learn and develop the right skills so their lives and communities are strengthened. And we know that healthier, more educated communities are stronger communities. So who are we? Who do we represent? And a little bit about our background. Virginia's community college system covers 23 colleges, which span 40 campuses across the Commonwealth. We're a diverse network of highly trained faculty, advisors, career coaches, in our health professions pathways, and other disciplines as well. We have a higher than average passage rate on our national medical certification exams. We offer state-of-the-art training labs and classrooms. We also have tuition costs which are well below the national average, with a bachelor's tuition savings of up to $41,000 compared to those who attend a traditional 4-year school. We also have childcare centers that offer childcare services at a reduced cost for our students, and many of our courses are Z degree courses, which means that students pay little to no cost for their textbooks. filling the gap in our workforce needs and how we can help address these shortages. In our healthcare professions pathways, we offer certificates and 2-year degrees in everything from nursing, nursing aides, pharmacy techs, phlebotomy, for EMS workers, and in health information management, all areas which can help support the need for healthcare workers and how it's disadvantaging Virginians today and relating to patient outcomes. What are some of the next steps, and how can the VCCS help to strategically plan and provide these educational opportunities to help reduce this shortage? Well, there's a lot of things that we can be doing, and one of them comes down to helping target prospective students, perhaps in newer ways than we have traditionally before. So expanding the net, so to speak. We have 1.2 million soon-to-be high school graduates in high school right now. So we could certainly be in our high schools. We could be working with career counselors and working with educational systems and school boards to ensure that we have a presence in our high schools, that students know that we are a first option for their next step of their educational journey. We can also be trying to reach our non-traditional students, those out there who may be ready for a career change, who may be outside of those high school years, who may have already worked in other workforces or disciplines, who could have skills and knowledge which could help prepare them for a career in healthcare. We can also be targeting employees looking for educational continuing opportunities for their employees, for those who are looking for credits or those who are looking for professional development, and employers who are looking to help increase the training and knowledge for their employees. Career days and college fairs to increase a presence for students to be able to come and see what we offer, be able to communicate and see with our faculty and our staff, be able to see our facilities, and be able to get that hands-on experience to see what we're offering and what they can learn with us. We also need to be addressing the educator shortage. So with our aging workforce, we are also seeing that we have educators, everything from nursing to a range of health information management faculty who are retiring as well, which means that we also need to be addressing how we can fill those gaps in those who are educating the next generations of healthcare workers. So going out into the community and finding information and finding opportunities to connect with and network with healthcare workers who are willing to start a new career or adjunct or part-time, be part-time educators within these systems so that we have a strong stream of educators who will continue to serve in these educational settings and prepare the next generation of our healthcare workers. Strengthening partnerships with four-year schools, local four-year schools, will also be something that will help and create an advantage strategically. So from finding ways to create a bridge or a crosswalk from the associates of nursing to the Bachelor of Nursing, which could certainly help with additional training and wage increases for those professionals, which particularly supports minority women, research shows. In addition to some of those strategies, we can also be looking for ways that we can continually update and increase the opportunities for students to have help financially to complete their degree and to complete their education. One of the ways that we have already started this in the VCCS is through the G3 program. This is our Get a Skill, Get a Job, and Get Ahead program, which was started under Governor Ralph Northam's tenure. This is a last dollar program for Virginia residents who fall below certain socioeconomic levels. It's specifically designed for students in healthcare, and we've already seen a significant increase in student enrollment and retention since the program started. But these initiatives require funding, they require political support and advocacy, so certainly ensuring that we are encouraging these funding opportunities, we are encouraging legislators and policymakers to take a look at the importance of these programs and initiatives and to keep them around as long as we can will be imperative moving forward. A stronger Virginia really is a healthier Virginia. It's a more educated Virginia. We know that health and education help to build stronger, more resilient communities, and will create a state for opportunities here for all of our citizens. We've been in tough places before in Virginia, whether it's economically, politically, or public health wise. But moving forward, it will require partnership and strategic planning across educational systems, government, and community. But we can get there, and the VCCS can be a way to help with this gap and to help increase our healthcare workforce. Thank you so much for listening.